All right, hi, thanks for joining us. Today we're going to demonstrate how to tape the knee if somebody's having patellofemoral issues. So before we do any of the taping, we're always going to use our rubbing alcohol, some cotton, clean the area so that there's no oils or residue on the skin. Let everything dry. I've pre-cut our tape pieces, so I rounded the corners. The first piece we're going to put on is going to go underneath the patella, right over the tibial tuberosity. So again, we're going to rip the tape down the center, peel back the ends so that we're not touching any of the tape. We are, for the bottom part, because this is a joint application, apply 50% stretch, keeping those thumbs parallel so that the tape goes nice and flat. So that's the base, that's the treatment area. We left an inch, inch and a half on either end so that we can anchor it to the skin, peeling the sides back. We're always going to use the back of the tape, give it a little friction to heat it up. That heat is what activates the adhesive in the tape so that it will stick. Sometimes this alone will be enough if somebody's having knee issues, but we're going to go ahead and demonstrate the other two pieces to help support in that. So the other two pieces are both going to start proximal to the knee. We're going to not overlap. We're going to use an anchor up at the top, 25% stretch, and then we're going to come around the knee. So again, to rip the tape, you only need to rip one end because we'll be able to peel it back. I'm going to again peel the tape without touching the adhesive. Apply it. Again, no stretch. The quads are in a slight stretch just because the knee is in flexion. So when we do that muscle application, giving just a little bit of stretch, I'm going to work the tape around the knee. Again, 25% stretch, and I know what that is because we're using the Thera-band K-tape. Bringing the end down below the first piece of tape so that this anchor was applied with no stretch will stick to the skin. And we're going to apply the last piece, again, tearing it with it facing the front, making sure that we don't touch the adhesive part of the tape, applying it up at the top so that the two pieces of tape are not overlapping at the top so that they'll both stay on for that 3 to 5 day duration that we're looking for. No stretch to the anchor, wrapping around the knee, 25% stretch, crossing over ideally so that our last anchor will land on the skin. So again, our last inch, inch and a half, there is no stretch to the tape. So we then can activate the whole area. And then it's nice to notice right now the skin looks all smooth, but once you're done with the taping and the client stands up, there is going to be a little change to the skin that you'll notice. So if we can just have our client stand up, then that's what it looks like at the end. Thank you for watching this video, and we'll see you again in the next one. Have a great day.